Hello, my name is Jose Miranda Velasquez. This video is for VSN 206-14 for the sterile glove and hand washing technique video. For this video, I want to just point out that I do have to touch my computer and move the computer a little bit to get it within focus and within range as I was doing my hand washing um, procedure. And I do want to point out I have my Nightingale scrubs, and then you can see my badge here. I will go ahead and point out as well that my gloves have been opened due to me practicing, and they are already open. These are no longer sterile. But I will walk through the procedure as well. All right, so here we go. For this procedure, want to make sure we have the correct size gloves. In this case, we want to make sure our gloves fit. Want to make sure that the packaging is sealed and intact to ensure that the gloves are still sterile and to ensure that they are dry and there's nothing wrong with the packaging or the gloves primarily. So we're looking to make sure we look on the edges, make sure that the packaging is sealed. Like I said, this is live as I've been practicing, and then we move forward from there. From here, I will focus my camera into the sink. From here, I want to make sure that I am over the sink. At this point, I look at my hands and my fingers to make sure there is no cuts or lesions, to which at this point there is not. I want to make sure that I don't touch my sink from here and that I can reach down into the sink without making the water that I'm washing my hands with go everywhere. I want to make sure that I have warm water, and I want to make sure that I have my soap and paper towels to dry my hands off with. I want to make sure that I can keep my elbows down to my side and my hands down, pointed forward at all times. I want to avoid flickering my fingers with the water to avoid getting it everywhere. I don't want to do that. I want to make sure that I can just keep my hands downward here. Once I open my faucet here, I want to make sure that I am not touching anything else. I want to make sure that everything is, uh, a one-step motion without touching other things once I have washed my hands. I want to remain as clean as sterile as possible. Go ahead and open my water. I want to make sure that the water is nice and warm and that the stream is nice and gentle without it being like a forceful or a violent stream. It's just a nice gentle stream here. I want to make sure that I'm washing my hands, starting at my wrists, going down to my fingers, nice and gently and slowly with the warm water. Okay, I want to get soap here. I want to make sure I have a nice 3 to 5 milliliters of soap and start rubbing my hands here without touching the sink. And I want to wash my hands here in between my fingers, on the upside, the top side of each hand, in between my fingers. And I'm constantly washing my hands here. At this point, I want to make sure that I'm washing my hands for 15 seconds or so. I want to make sure I'm getting underneath each underside of each nail to make sure there's no soil or debris, and they are clean of that on all 10 fingers as I'm washing my hands. And I continue to wash my hands here. Once the 15 seconds are up, I can go ahead and start rinsing my hands, starting again at the wrist, going towards the fingers. I don't want to flick my fingers. I want to just let the water drip off of it. And I want to make sure that, like I said, my elbows are here, my fingers are, in a downward position, so that the water is just coming off nice and gently. I will then go ahead and proceed to grab my first paper towel after all the soap has been washed off and damp my hands here without making a mess, without having it go everywhere. And then I will dispose of the first paper towel. I will take my second paper towel to ensure that my hands are nice and dry, nice and gentle here. I will discard my second paper towel to the garbage can. I will then take my third paper towel and use that to close my water faucet, and then discard that as well to my biohazard bin. I want to make sure that nothing else touches anything else, the sink, the faucet, the garbage can. I want to make sure that my hands stay at my side here, my hands pointed down here, or fingers pointed forward without it touching anything else. Of course, at this point, I have to touch my computer to rearrange it here. And like I mentioned before, I want to have my area here nice and dry and clean. And most importantly, that is a flat surface. I will take my gloves here. I will go ahead and part it, remove my gloves from the packaging, and place my gloves down, discard the packaging, discarding the packaging. I will go ahead and then open my gloves. And I can touch the outside of the glove here, the 1 inch margin all around. And then these little flaps here, I can go ahead and touch that, but nothing on the inside. Because the idea of this is that it is sterile and don't want to break the sterile field here. I will then go ahead and open my glove without touching anything else. And I can visualize my left glove and then my right glove here. I will take my non-dominant hand with 3 fingers, attempt to put my glove on, and manipulate my fingers into the glove without breaking the sterile field. At this point, I go ahead and lift my left glove up and attempt to slide my dominant hand in. Nice and gentle. Touching only the outside of the glove here. The inside of the glove, pardon. And attempting to get the glove on without breaking the sterile field here. Once this is done, I will then go ahead and take my left glove that's gloved and use a cup method to go ahead and lift my other glove up and attempt to slide the glove on without breaking my sterile field. As nice and gently as possible as I can. Put the glove on. Slap it on. Then I will go ahead and interlock my fingers to ensure that the glove is on nice and tight and to make sure it's on pretty good here. I will then go ahead and do my procedure. I can fix this here if I need to. The glove ideally should fit on and come on correctly once I interlock my fingers here. I will then go ahead and perform my procedure. Keep my hands down to my sides. And I want to keep my elbows down my side, my hands below the waist. I will then, at this point, go ahead and once I'm coming back from the procedure, go ahead and doff these gloves. With this, I will go ahead and take my dominant hand, pardon, my non-dominant hand. I will ball this up here. These gloves are, as you can see, are nice and tight, so I will do my best to take these gloves off without breaking my sterile field and without getting things everywhere, or the contents of the gloves everywhere. We'll go ahead and fold it inside out, ball it up, using 2 fingers, take my other glove here and attempt to take it off nice and gently. Once this is inside out, I will go ahead and discard these gloves, touching only the inside of the other glove. And then I will take the piece of paper here and discard that as well. Into my biohazard bin. Once that is completed, I will then go ahead and perform my hand hygiene, ensure my patient privacy. If I'm going to step out of the room, I will close the door behind me or the curtain, and then I will document my results of my finding. That is my end of my video. Thank you so much.